Assalamu alaikum. Welcome again to the clinical sessions series. Today we will talk about the trying stage. The trying is a preliminary insertion of the trial denture to determine the fitness, aesthetic, and maxillary mandibular relationships of the denture before processing. It is the last opportunity to evaluate many of the previous steps already accomplished, and it offers opportunity for patient education and facilitates the patient acceptance of the finished prosthesis. So what should we check at the trying stage? We should check two times, checking the trial dentures on the mounted casts on the articulator and checking inside the patient mouth. The first check, which is the check on the casts that's mounted on the articulator, I advise you to check it beside the technician, because if there is any technical defects, you will notice this on the casts and you will told him to repeat the technical work. However, so we start with the examination of the trial dentures on the mounted casts, starting with checking the adaptation of the record bases or the trial dentures on the casts. They should be very well adapted and closely fitted with no gap between the trial denture and the underlying casts, because in the final process denture there will be no gap. So if you have a space here between the trial denture and the casts, this will result in distortion of occlusion or defects in occlusion at the final process denture. The second thing to check on the articulators is the occlusion of the maxillary and mandibular dentures. As we can see in the first photo, there is a defective occlusion and improper intercuspation between the maxillary and mandibular dentures, and after correction of the relation, in the second photo we can notice a very well maximum intercuspation between the maxillary and mandibular denture, and this is our goal, whether it was an artificial teeth or intercuspation with a natural teeth of the patient. The third thing to examine is the position of the artificial teeth with regard to the adjacent natural teeth. The artificial teeth, should be arranged following the curvature of the arch, arranged on the crest of the ridge, and in harmony with the adjacent natural teeth, and provide good intercuspation with the opposing natural teeth. Also, we should examine the arrangement of the anterior teeth. They should follow the curvature of the arch, and they should be in harmony with the remaining natural teeth, taking into account the shape and the size of the teeth. After we complete the previous steps of examination on the casts, now we start examination of the trial dentures inside the patient mouth. One important thing to notice is to disinfect the trial dentures before inserting them inside the patient mouth. So, we take the trial dentures from the articulators, we disinfect them, and then we insert the trial dentures inside the patient mouth, starting with the examination of adaptation of the dentures inside the mouth and into the underlying supporting tissue. There should be no gap. The trial denture should be very well adapted, as we said before, to avoid any future problems with occlusion. The second thing is to check the occlusion of the artificial teeth with the opposing artificial or natural teeth, and also we check the vertical dimension of occlusion. After we insert the trial dentures inside the patient mouth, we guide the patient or ask him to close in centric relation. This has been demonstrated previously in the previous lecture, how to guide the patient into centric relation. So we should have the same intercuspal position or intercuspation inside the patient mouth, the same as the intercuspal position or intercuspation on the articulator. We should have exactly the same relation between the teeth on the articulator and inside the patient mouth. Always check this point. If there's any defect or any difference between the relation of the teeth on the articulator comparing with the relation of the teeth inside the patient mouth, this means that you register the maxillomandibular relation in a wrong way. So you need to repeat the registration of the jaw relations. So, uh, as we said, if we have to check the vertical dimension, like if we don't have a vertical stop, or in cases that we don't have contact between the maxillary and mandibular teeth, so we need to check the vertical dimension of rest and vertical dimension of occlusion and see the difference between them, which should be 2 to 4 millimeters to provide freeway space. This is in case if we don't have a vertical stop, which is a contact between the maxillary and mandibular natural teeth. But if we have a vertical stop, which is the contact between the maxillary and mandibular natural teeth, we don't need to check the vertical dimension. We only check the centric relation. This will be clarified more in the clinic, inshallah. Also, we should examine the appearance of the trial dentures, including the position of the anterior teeth, providing lip support, whether it was over-supported, under-supported, or well-supported. In addition to that, checking the midline of the teeth and checking the size of the teeth, shape, the shade of the teeth, and also checking the position of the incisal edge at rest and when the patient is smiling. The final thing to do at the train appointment is to show the dentures to the patient. Of course, we insert the dentures inside the patient mouth and give him a mirror to see how he is looking and ensure that the patient is satisfied, and any comments on the appearance should be corrected, whether he wants to change the shape of the teeth or the shade of the teeth, or if he wants any customization, like he wants to do slight crowding or he wants spacing between his teeth like the old natural ones, or whatever, if it was possible, of course. That's all. Thank you and wish you a good day.